Okay, this is Miss Jane, and Miss Jane, tell us how you did with your Wharton's Jelly stem cell treatment for your chronic knee pain.
I did very well. I was in a lot of pain. I couldn't walk without limping, and I had the stiff knee. My son still says I walk like a pirate because my knee was stiff and I didn't want to bend it because it hurt. And of course he still says that because he just doesn't realize what I've been through. And but now I'm almost completely cured because it's been going on 3 months, and some days I'll have complete control with no pain. Other days a little bit, but it kind of goes away, comes and goes. And I feel as though, I would highly recommend this to anybody that would like to have less pain. I had one knee replacement. I didn't want to do that again. I wanted to try something different. And I figured, why not give it a try? So I was pleasantly surprised that it really worked. It didn't hurt, to have the injection, and I didn't have any pain afterwards. And the only part I didn't like was having to come to Tampa because I live in Orlando and I hate driving, so I did, find another way to get here. And so now my 8 weeks are up, and
That's right. So we did some additional therapy on you
Yes.
once a week for 8 weeks.
Right, and
We
that's
did
why
your
I had
actual-
to come to Tampa.
The nurse practitioner did the actual injection in
right.
Celebration
Uh-huh.
at the Celebration office. Now, people need to understand with this treatment, because we always tell patients this. The only stem cell procedure the FDA approves is umbilical cord blood stem cells for certain types of cancer. Everything else they want us to tell the public is experimental.
Uh-huh.
But just because it's experimental doesn't mean it doesn't work.
Right,
Right?
exactly.
So as long as people understand that. But your diagnosis, you have osteoarthritis in the knee.
Uh-huh.
And we use the Wharton's jelly in your knee.
Uh-huh.
And being the Wharton's jelly, it helps, when we put that in the knee joint, it helps cushion the knee.
Right.
Like it does in the umbilical cord, it cushions the umbilical cord blood vessels. And when we use it in the knee, and the FDA allows us to do that, because it's acting like it did in the umbilical cord, it's acting like a cushioning agent. And that's how it helps. And it has those mesenchymal cells and other factors in it. But like you said, you feel like you're cured, but we all know, everyone
Right.
knows osteoarthritis cannot
Cannot
be cured.
Exactly.
And you still have to be careful and
Right.
do the
Oh,
things you're
definitely.
supposed to do.
But I was told I would need a knee replacement by the same doctor that did my right knee, and I mentioned to him, what about stem cell? He's poo-pooed it. No, you should get your knee replaced. And I said, well, I'm leaving for Florida. He said, well, it may be too severe when you come back in October. And I said, well, I think I'm going to take my chances. So he took I had the x-ray sent to me so I could give it to the doctor here. And he, said, okay, let's do it. And I said, okay, let's do it.
Good.
And so
Well,
I'm
very happy.
very, very pleased.
Happy you had a good result.
Yes, me too.
Okay, thank you.